The hearing mechanism is thought to be divided into multiple components, the outer ear, the middle ear and the inner ear, and each division has got its own function of collecting the sound signals, then amplifying the sound signals, and finally converting it into electrical impulses and then reaching that into auditory cortex by way of the eighth nerve. So this part or the physiology of hearing was described in detail in an earlier class. So today's topic is acoustic reflex or the stapedial reflex. Acoustic stapedial reflex. This is very important. So what is it? What is the reflex arc and the uses of stapedial reflex? Okay. So you know that from the middle ear, that's a pathway of hearing which we can remember by echolema. That is eighth nerve from the middle ear, then to the inner ear, from there through eighth nerve. It go to the brainstem, and in the brainstem there is a cochlear nucleus and then the superior olivary complex and also the nucleus of seventh nerve, facial nerve. Okay, so in the brainstem there is ipsilateral as well as there is crossing over to the opposite side, and then from the nucleus of seventh nerve it goes to the facial nerve, and then facial nerve supplies stapedius tendon. You know that because there are two muscles in the middle ear. One is a stapedius, another one is tensor tympani, and the stapedius is supplied by facial nerve. So here also from the middle ear, then to the inner ear, and then to the cochlear nucleus through eighth nerve, and from there to ipsilateral as well as contralateral, the olivary complex and also the nucleus of facial nerve, and then to the facial nerve. So this is the reflex arc of stapedial reflex or the acoustic reflex. So here this through the eighth nerve goes the afferent limb. Afferent means away from the sense organ, and efferent is coming from the center, it is coming to the sense organ through the seventh nerve. So eighth is the afferent and seventh is the efferent. Okay, so what is the stapedial reflex? The acoustic reflex is the involuntary contraction of the stapedius muscle. You know that the stapedius muscle is in the posterior wall of middle ear, which is supplied by facial nerve. So the involuntary contraction of the stapedius muscle in response to a high intensity sound stimulus is called the acoustic reflex, and so there is a sound stimulus and this causes contraction of the stapedius muscle. So that is the acoustic reflex, and the lowest intensity of the sound stimulus which triggers this muscle contraction, and that is called the acoustic reflex threshold. Okay, acoustic reflex threshold. So now you know what is an acoustic reflex and what is acoustic reflex threshold. So it is involuntary and it is also bilateral. Okay, there is ipsilateral, you know, on the same side, and contralateral means ipsilateral for any case. Ipsilateral is on the same side. Contralateral means of the opposite side. If the right is stimulated, the left is also contracts. Okay, that is contralateral reflex. Okay, so that is the opposite side. And bilateral means both side, both right and left. Okay, so ipsilateral, contralateral and bilateral. This acoustic reflex is, it can be ipsilateral or it can be bilateral or it can be contralateral also. This acoustic reflex do not measure the hearing threshold. Rather they measure the reflected energy which is a function of the stapedius muscle contraction. So it allows one to indirectly assess the middle ear, cochlea. So this assess indirectly we can assess the middle ear, we can assess the cochlea, and also the neural innervation of the stapedius muscle, that is the integrity of the facial nerve. Okay, so we can assess indirectly we can assess middle ear, because this is measures the reflected energy, which is a function of the stapedius muscle contraction. So we can assess middle ear, we can assess the function of cochlea, and we can also assess the status of facial nerve. Okay. What is a acoustic reflex and what are the component or the afferent and efferent and also the center of reflex arc? Again, from the middle ear to the inner ear, sound and then mediated by eighth nerve, which is the afferent limb. It goes to brainstem containing cochlea nucleus and also the superior olivary complex and nucleus of facial nerve. From there, through the facial nerve, it comes to the stapedius tendon, and we are measuring the involuntary contraction of the stapedius muscle, and the minimum threshold needed for this contraction is called the acoustic reflex threshold, and the normal acoustic reflex threshold can be 90 to 95 to 100 dB of decibel of sound pressure level, SPL. That is for tones, and this can be 70 to 75 dB in case of wide band noise. Okay, so no need to get confused. You just remember that it is normal is 90 to 95 dB SPL for the tones. Okay. So that means that much of tone has to be given, sound has to be given to the middle ear in order to produce a normal stapedial reflex. So in order to get a very good understanding, you should have an idea on this different ipsilateral, contralateral and bilateral pathways. In an ipsilateral pathway, starting from the middle ear, the sound reaches the middle ear, and from there to the inner ear and through eighth nerve, the same side cochlea nucleus, through the same facial nerve it comes and it causes contraction of the stapedius tendon on the right side itself. So this is right ipsilateral pathway. A sound stimulus produced to the right side can also cause contraction of the stapedius tendon on the left side. That is through a right contralateral pathway. That is, the stimulus sound signal is reaching the middle ear on the right side, and the signals after crossing over to the opposite side, it causes contraction of the left ear stapedius tendon, and that is called the right contralateral pathway. There is a right ipsilateral pathway, right contralateral pathway, and in the same way there is also left ipsilateral pathway and left contralateral pathway. Okay, got it? So when sound stimulus reaches one ear, it can cause contraction of the stapedius tendon on the same side and also on the opposite side. Okay, if sound signals reaching one side, it will cause ipsilateral stapedial reflex on the same side and also contralateral on the opposite side. And by knowing this, we can find out the we can localize the pathologies by using this acoustic reflex. For example, one, if there is injury to the facial nerve on the right side, so anything reaching on the right side will be absent. So what will happen? The right ipsilateral will be absent and also left contralateral will be absent because the efferent limb is not working, and left contralateral reflex will be absent. There is no need to by heart all this. You just be thorough with this reflex arc. This reflex arc itself can be asked as a short note for undergraduates. So if you are thorough with this reflex arc, the whole thing will be very simple to you. Okay. So see, if the right-sided facial nerve is affected, the right ipsilateral reflex, stapedial reflex will be absent, and left contralateral reflex will be absent. What will happen if there is middle ear pathology? So anything which is going through this will be affected. So in case of middle ear pathology, this will be affected and also the other side will be affected. So the middle ear pathology, the right sided, ipsilateral and also right contralateral will be affected. Okay, so in middle ear pathology, the one going through the afferent tract will be affected on the same side and also on the opposite side. Suppose in the brainstem there is a very small intra-axial pathology. So the ipsilateral thing will happen, only the crossover will not happen. So in a case of small intra-axial, small brainstem lesions, the ipsilateral reflex will be okay, but the contralateral one will be absent. And what will happen if there is a large brainstem lesion? In large brainstem lesion, all the reflexes will be absent. Okay, so what are the uses? Now you can easily tell the uses. What are they? One, to find out non-organic hearing loss in case of malingering. Okay, we can detect it. If the patient telling that I can't hear, simply telling that I can't hear, by using this we can elicit the ipsilateral as well as the contralateral stapedial reflex and can tell that the patient is malingering. So that is one thing. Second is in the lesions of middle ear like ossicular discontinuity or otosclerosis, etc. So middle ear pathology. And third, in the lesions of facial nerve, by finding out whether the ipsilateral or the contralateral, we already discussed that. So the seventh nerve lesions, and then we can also find out the brainstem lesions by looking into the stapedial reflex, brainstem lesions. And another one is in case of cochlear pathology, the recruitment will be present. So if we are getting a stapedial reflex positive, normal stapedial reflex, reflex is present if a threshold of less than 60 dB, that can point out to an cochlear pathology. Okay, because of the presence of recruitment, if the threshold is less than 60 dB and you are getting a positive or a stapedial reflex, then it is pointing towards a cochlear pathology. So you know what is an acoustic reflex? That is an involuntary contraction of the stapedius tendon in response to a reflex sound signal. And what is the reflex arc? Afferent is through 8th nerve, then to the cochlear nucleus, then olivary complex and nucleus of facial nerve. After that, through the facial nerve, it is coming to the stapedius tendon and there is crossing over to the opposite side also. So ipsilateral, contralateral and bilateral reflexes. And also now you know the uses of acoustic reflex. This is very important for audiologically, and also this can be asked in viva and also in short note. Okay.